Good afternoon. My name is Kevin CLEGHORN. I'm the Saline County Coroner and President of the Arkansas State Coroners Association.
My name is Ahmed Youssef. I'm the Medical ICU Director in a hospital here at Saline Memorial Hospital.
My name is Mark Chu. I'm a family physician with Family Practice Associates.
I want to thank you guys for joining us today, and thank you, Dr. Youssef and Dr. Chu, for joining me with this. What prompted this public service announcement is my office has begun to see over the last month a rapid increase in scene deaths, residential deaths, in a lot of our patients that have been suffering from multiple different diseases, cardiovascular disease, congestive heart failures, chronic obstructive pulmonary disease, diabetes, multiple array of different conditions. And in some of our community leadership meetings that we've had during this situation that we have found ourselves in, we have been discussing multiple different agencies, the hospitals, and not just here in Saline County, but statewide. I've been on multiple conference calls with different disciplines. We're seeing this problem arising statewide where a lot of our citizens are not wanting to seek medical care. They're not wanting to go to their hospitals. They're not wanting to go to the emergency departments, to the family practice clinics, the different areas where they can seek medical care, refill prescriptions or whatever. We're seeing an increase in those patients not wanting to seek care, and ultimately my office is having to respond, or my colleagues around the state are having to respond to the residents when their families find them deceased. And we're hearing this over and over and over by families telling us, we're trying to get them to go to the hospital. We're trying to get them to go to the doctor, and they're not willing to do so for fear of getting sicker, more, for the lack of a better terminology. And I know Dr. Youssef and I were talking just recently that they're seeing in hospitals, as well as not just here again in Saline County, but statewide, a decrease in inpatients, numbers with these medical conditions. And I guess what we're here today to get the point across to our citizens in Saline County and across the state, these diseases, this disease process in the body, they don't stop just because COVID-19 is here. They don't stop because we're in a pandemic. These disease processes are still very real. They are still rampant. They need medical care, and without that, you're not going to survive in many cases. And like I said, we are seeing this happening right before our eyes now. This is something that has been very alarming to my office, and I would rather be proactive than reactive in this situation, because I love my county, and my citizens. I think I would fail them if I didn't bring this problem to light. I know you guys probably have seen things in your disciplines as well that kind of correlate with what I'm seeing out in the field. So I reached out to the Dr. Pafford, Dr. Youssef, and his staff here at Saline Memorial to join me with this public service announcement to bring light to our communities. Folks, whatever we do, if you've got family that have these diseases, they have medical issues, that they're on medications. I know we're quarantining a lot. We're being quarantined a lot. The elderly population, it's not safe really for them to go out a lot of times when their immune systems are not the best. We need to be checking on them. We need to make sure that we are making sure they have their medications daily, encouraging them to go to the hospital, seek the medical care that they need. That's ultimately what we're here for today. Dr. Youssef, if you want to give insight as to what we're seeing on an inpatient level, maybe corroborate what we're talking about.
I appreciate the a chance to kind of speak to the community at large and on behalf of the hospital staff, right, which is what I can speak to directly, is that we're definitely seeing an increase in the sicker patients, and that people are staying home until the very, very, very kind of last moment and coming in so sick that it's very difficult to kind of get them back, right? And so we're seeing many people, for reasonable reasons, you know, the fear of getting the virus and so on and so forth, trying their best to stay home, you know, sheltered in place the way that we've been told over and over again is the right public health decision. However, you know, we're open for business. That's what we've been saying over and over again as a hospital. And what I mean by that is that, you know, we have developed in the hospital protocols and policies to ensure that we keep separated patients that are at risk for, that are presumed or possible potential positive patients for the virus, and everybody else. We have floors set up in a manner, enough PPE, negative pressure areas of the hospital set up so that we don't put people at risk who have other chronic comorbidities that are presenting for acute exacerbations of those comorbidities, you know, being at risk from getting infected someone here. And our nursing staff and our RT staff and everybody from all the way to the top, from the admin all the way down to the, you know, the dietary teams, all understand and have done a tremendous job here in ensuring that we keep people who are not infected with the virus and not presumed separate from everyone else. And that's a guarantee I can make from in terms of the effort that we're putting forth in the hospital. And so I'd encourage, just like, you know, our coroners are talking about today, that the best thing that you can do if you're ill is go see a doctor, right? And Dr. Chu will talk about what it means from an outpatient perspective. And if you're sick enough to have come to the hospital before all this, you're still sick enough to come to the hospital now. And that's what I kind of reassure you to understand. If you were going to call 911 before this COVID thing happened, you should call 911 now. And we'll take care of you. And if you're not sick enough to be in the hospital, I promise you we won't put you in a place that you don't need to be. We're being very judicious about ensuring that we're putting people who need to be here and letting people go home who need to go home. So I'll pass it off to Dr. Chu and kind of hear what he has to say.
Yeah, thank you guys for that insight there. It's very helpful. In the outpatient setting, you know, I understand people don't want to come to, same as with the hospital, they want to come into your doctor's office for fear of getting sick. But with this pandemic here, we've had a lot more opportunities to do what's called telemedicine. You may hear it referred to as an e-visit or a telehealth visit. However it's referred to, it's a safe and secure method of having a visit with your physician or your healthcare provider in the safety and comfort of your home. Now, it's no replacement for that hands-on, face-to-face experience you'll have in an office, but, you know, like Kevin says, your diabetes, your hypertension, you know, your chronic disease process, they still happen. They're still there. They don't pause because we're in a pandemic. And so you can have exacerbations, and then something that we can potentially address, help you manage a little bit better, so that you don't let that diabetes get out of control. You don't end up in the hospital with your blood sugars, you know, or in the ER with your blood sugars too high. And so it does put a lot on the patients to help kind of, you know, manage and monitor themselves as well. But the telemedicine allows us to see you the patient, you see us, you know, help hopefully treat, manage a little bit better. And it's not only for the acute things, but for chronic things, but for acute problems too. So, you know, call your doctor's office. Every office is going to have a little something different. They may call a little something different, but I know in our office we've trained our staff, our schedulers, our nurses, our MAs to help patients when they do call. If they have trouble logging in or getting to the website, you know, we give them some basics of how to get to where they need to be so that we can get that visit, see you, treat you, and hopefully keep you out of the hands of these two guys to my right here.
My philosophy is I would rather them see you than to see me.
Yeah, I agree.
Most definitely. And ultimately, if we don't take care of our families, if we don't take care of ourselves, we don't take care of these medical conditions, seeking the assistance of these guys, especially Dr. Chu, much rather start on that end of it. You know, go see Dr. Chu, go see your primary care physicians. That way I don't have to come and see you. If you have questions about healthcare, your doctor's offices are willing to answer anything any questions that you may have. There are areas of the hospital staff that would be willing to answer questions for you if you have them, or call my office. Call my office at 303-1559, and we will help you in any way we can to avoid to avoid having to come to your house. Does anyone have any questions for one of the three of us before we adjourn?
So I know that the governor made today, April 27th, as the date where people can begin to do elective surgeries again. Would there be anything that you would want to tell the public specifically about how to go about getting that elective surgery that they've been putting off for the past couple months?
Yes, I can speak to that a little bit. Because I'm not only speaking on behalf of this hospital, and every hospital is having a different rollout plan, I'll speak in general, which is call the physician that you were initially planned to have that elective surgery with. Those offices have already developed through hospital systems like ours, very detailed plans based upon the governor's recommendations and the health department's recommendations, as well as kind of internal logistical concerns, to make sure that everybody is kind of processed safely, that the people that need to be tested are tested, that both the patient, family, and staff members are going to be made safe during those procedures as people are processed, and be patient with us a little. I think one of the caveats I was thinking of as we were talking out loud is we've learned so much in the last 2 months that we never had to think about before. We've had to learn how to do things differently, just as everybody at home has learned to do things differently as well. And so, just like that, elective surgery kind of falls in that category in this context. Elective surgery were an easy thing 2 months ago, and now we have to walk a slightly different, more careful path. And we've learned as we've gone along, and the time away has allowed the admin teams and the different doctor groups and nursing teams come up with policies and protocols to make everybody safe. So the first thing I would do is I would call that physician's office. I would see what the current process is for scheduling, what the expectations are, and then I would ask you, even though it's really difficult because I know everybody's been so patient, is be patient, because we don't know what's going to happen going forward. We're just trying to work with the best information that we have.
Again, thank you very much for joining us, and thank you, Dr. Youssef, Dr. Chu. We appreciate what you guys are doing on the front lines with this pandemic. So thank y'all again very much.